The other piece of this, and Drew, I know this struck you when we were watching you inhale.
Yeah.
That especially, I mean, you touched on it looking in the oral cavity, but when you're actually snorting, I mean, your nasal passages, the inside of your nose, the back of your throat, your upper airway, your lungs are all at risk with these particles that when they stick to the lining there, they can cause erosions, just like you said. They can be a seed for an infection in any one of those sites. That type of infection potentially can be very, very serious.
This realistically could kill you. And I wanna turn to you, Judy, because this is hard for us to watch, because I can see someone eat even clay and say, okay, like it's clay. But watching her eat that harsh cleaner was really, really difficult. And yet it happens.
Yes, yes, and pica is a more rare problem, but it does occur, and there's different substances that people ingest, and we do know some factors for why it might happen in the first place. So how old were you when you started this?
I was 14 years old.
Okay, you were 14. So what we know is that sometimes there is a link to compulsiveness, meaning if you have perfectionistic tendencies, you really have to have everything ducks in a row, you really are a little bit rigid. Like, there are actual imaging studies that show that individuals with obsessive compulsive disorder, for example, their brains look very similar to people who also have symptoms of pica.
Okay.
So that's one thing. Another thing is we find that there is a correlation with some kind of developmental trauma. If you've had any traumatic experiences as a child, this is almost a way to feel safe and to calm anxiety. So I was just wondering, as I'm telling you this, if any of this sounds familiar to you around that time or before that time?
Around the time that I did start, I was about to start high school. You know, everybody just get in your ear, the girls are this, the guys are this, you know, just straight nervousness. So I don't know if that could have played a part into it. I would say so. But I guess once you already were in the groove, I never even thought about stopping. You know, it's like, okay, it just became a part of my normal routine.
How did you pick Comet?
My mom, I mean, she cleans. But she always used to clean with Ajax, and I used to love the smell of Ajax first. But once she found out that I was smelling Ajax, she stopped buying it.
How do you feel now that you know that your blood work is actually being affected and the inside is being affected?
It's like a slap in the face, because you know that something could happen, but I guess you never really take it serious until something does happen. But with this, it seems like it could be a silent killer, and that's why I think my husband is so worried, because one minute I'm gonna be okay, and the next I won't.
You're here on our stage, hopefully because you want help. Are you ready?
I'm ready. I do have a baby, and I need to be here for him. And I can't be in no hospital bed. I can't be, you know, none of that.
And you know, it's a vicious cycle too, because when you're eating the comet and it's causing erosions and you're losing blood and you have this anemia now, which is this low blood count, it's gonna actually trigger you to crave these non-nutritive substances. That's what we call pica. And so it's a vicious cycle, because now you're gonna crave it more, you're gonna become more anemic, crave it more. So the first thing I wanna do, in addition to, you know, what they have in mind, is to write you a prescription for iron, so we can at least start that process.
And so I'm thankful for you, Dr. Sacher, for taking her under your wing, because today can be that day, and obviously a 10-year habit, we're not gonna fix it on stage in one day, but we want you to get better. So we actually have set up 6 months of weekly sessions with Kevin Burdies from Chapin Behavioral Therapy, because this is gonna take some time, but if you're ready for this, Kevin's gonna help you.
I'm ready, I'm excited. If we're gonna live life, we're gonna have to do it the right way.